Welcome to the Deep Dive, where we like to unpack complex topics and emerge with, I guess you could say, a real understanding of these topics.
Absolutely.
So today, we're going to be tackling a subject that's often, I think, misunderstood: palliative care.
Okay.
And, you might think it's just about end-of-life care, but get ready for some myth-busting. Because we're about to discover what palliative care really is and why it matters to all of us.
Right.
So let's just get right into it. What's the real deal with palliative care?
Well, first, I think it's important to emphasize that it's not about giving up. The World Health Organization actually defines it as an approach that improves the quality of life for patients and their families dealing with serious illness. Think of it as adding another layer of support to help you live better with a serious medical condition.
So it's not just about the final stages of life.
Not at all. One of the biggest misconceptions we need to clear up is that palliative care can be provided right from the moment someone is diagnosed with a life-threatening illness. At the same time, they are receiving treatments aimed at curing their illness.
Oh, okay, so that completely changes the picture then. It's about supporting someone throughout their entire experience with a serious illness, not just at the very end.
Exactly, and we see that reflected in a really powerful quote from Anatole Briard, a literary editor for the New York Times.
Oh, wow.
He was battling prostate cancer and said, "I'd like my doctor to scan me, to grope for my spirit as well as my prostate. Without some such recognition, I am nothing but my illness."
Wow. That's such a profound statement. It really highlights the need to see the person beyond just their diagnosis, right?
It does, and that's exactly what good palliative care does. It acknowledges your individual fears, hopes, and values while you're dealing with a serious medical condition. It recognizes that your illness is a part of your story, but it doesn't define you as a person.
I like that. So that brings us to the idea of a holistic approach, which our sources emphasize is central to palliative care. Can you tell us more about what that looks like in practice?
It's fascinating how palliative care addresses not just your physical needs, but your psychosocial and spiritual needs too. Think of it as supporting your well-being on all these different levels. Pain management is a big part of it, of course, but it's also about helping you cope with anxiety, depression, and the emotional impact of dealing with a serious illness. And it can even help you find meaning and purpose throughout this process.
Yeah, I'm really interested in that spiritual aspect. What does that actually involve?
Well, imagine being able to explore your deepest questions and fears in a safe space. Palliative care can help you connect with your spiritual beliefs and practices, giving you strength and peace of mind.
Wow.
It's not about imposing any particular belief system, but rather helping you find what gives your life meaning during a difficult time.
So it's about supporting your whole self, mind, body, and spirit.
Yes.
This must involve a lot of different people, right? Not just doctors.
You hit the nail on the head. Palliative care often involves a multidisciplinary team. Doctors, nurses, social workers, counselors, even clergy sometimes, all working together to address your diverse needs.
Wow, it sounds like a genuinely collaborative approach.
Yes.
But how does all this differ from end-of-life care? A lot of people seem to think they're the same thing.
That's a really common misunderstanding. The key difference is that palliative care is about improving your quality of life throughout your entire experience with a serious illness, while end-of-life care is specifically focused on providing comfort and support during the final stages when a cure is no longer possible. Palliative care can be provided for years alongside other treatments aimed at curing the illness, while end-of-life care is more about making you comfortable in your final days and weeks.
So end-of-life care is like a subset of palliative care.
Exactly. Imagine palliative care as a big umbrella covering all aspects of care for people with serious illnesses, with end-of-life care fitting neatly under that umbrella as a specialized focus for the final stages of life.
Okay, that clarifies things. But I have to admit, when I hear the term palliative care, I still think of hospitals. Our sources, though, talk about palliative care as a public health issue. What does that even mean?
Think bigger picture here. The World Health Organization is actually pushing for palliative care to be a public health strategy, encouraging countries to build it into their healthcare systems. It's about recognizing that palliative care isn't just a luxury, it's a fundamental part of healthcare that should be available to everyone.
That's an interesting concept. How would that actually work? What would it look like on the ground?
Imagine a world where pain relief is considered a basic human right.
Okay.
Unfortunately, access to essential pain medications like opioids is a huge problem in many countries.
Yeah.
This public health approach means advocating for policies that make sure these medications are available to everyone who needs them, of course, while also making sure they're used responsibly.
It's heartbreaking to think of people suffering unnecessarily because they can't get the pain relief they need. What else is involved in this public health approach?
Another key element is education. Healthcare providers need to be trained in palliative care principles so they can provide the best possible care to their patients. And just as important, the public needs to understand what palliative care is and what it can do for them.
Okay.
We need to break down those misconceptions and empower people to advocate for their own needs.
It sounds like a big task, changing policies, improving access to medications, and educating everyone about what palliative care really is.
Yeah.
Our sources highlighted some real-life cases from a presentation by Dr. Sarah Fakhruddin that really bring this to life. She talked about two patients, JN and MN, who were both living with AIDS and facing a lot of challenges. I think these stories can help us understand the human side of palliative care.
They absolutely can.
Shall we start with JN's story?
Sure. JN was a 48-year-old man living with AIDS, epilepsy, and he was also paralyzed from a stroke.
Right.
When he was admitted, he was incredibly thin, in a lot of pain, and couldn't care for himself.
Wow.
He didn't have much family support either.
That sounds like an incredibly difficult situation.
It was, and it highlights the complexities of palliative care. His case involved managing his pain and symptoms, of course, but also involved social workers trying to build up his support system.
Were there some tough decisions that had to be made about his care?
Definitely. The medical team had to consider whether he was even strong enough for certain treatments, who would be able to care for him long term, and how to best manage his pain.
Okay.
Sadly, his condition continued to worsen, and he eventually lost the ability to swallow.
Oh, wow.
His story is a powerful reminder that palliative care isn't just about physical symptoms. It's about addressing the social and emotional aspects of illness, too.
It's a stark reminder of the challenges so many people face. What about MN? What was his story?
MN was a 29-year-old, also living with AIDS. He was admitted to manage his symptoms as he was ineligible for certain treatments due to another condition called sclerosing cholangitis.
Right.
He was weak, confused, and having accidents. His social situation was really complex, too. He lived with his mother in very difficult conditions, and she hadn't even told her employer that he was there.
Oh, wow.
It added a whole other layer to the challenges they were facing.
It sounds like he was going through so much.
Yeah.
What role did palliative care play in his situation?
The palliative care team worked hard to manage his symptoms, of course, but they also provided emotional support to both him and his mother.
Okay.
They even went so far as to help find him a place in a care facility.
Wow.
Sadly, his mother wasn't happy with the placement and brought him back home. Eventually, he needed to be readmitted to receive end-of-life care.
These stories are so powerful. They highlight the complexities of illness and the crucial role that palliative care plays in supporting people through incredibly difficult times.
Yes.
It's not just about medical intervention. It's about understanding the whole person and providing care that addresses their unique needs and circumstances.
You've summed it up perfectly. Both JN and MN's stories demonstrate that palliative care is an essential part of a comprehensive and compassionate approach to healthcare.
I'm starting to see that this isn't just about end-of-life care. It's about how we approach caring for each other throughout life, especially when facing serious illness.
Absolutely. It's about recognizing the inherent dignity of every person and striving to provide care and support that allows them to live their lives as fully as possible for as long as possible.
Now, our sources mention something called the continuum of care. Can you explain what that is and where palliative care fits into it?
Think of it as a visual way of understanding the different phases of medical care you might go through, especially when facing a serious illness.
Oh.
One way to picture this is with 3 overlapping phases.
Okay.
First, you have care focused on diagnosing and treating the illness itself.
Okay.
Alongside that, you have supportive and palliative care, which focuses on managing your symptoms, providing emotional and spiritual support, and making sure you have the best possible quality of life.
Okay.
And finally, there's bereavement care, which supports your loved ones after you're gone. It's not necessarily a linear progression, though.
So it's not like you move from one stage to the next in a straight line.
Right. These phases can overlap quite a bit. You might be getting aggressive treatment for your illness while also receiving palliative care to help you cope with the side effects. And bereavement care for your family could begin well before your illness reaches its final stages as everyone prepares for what's to come.
That makes sense. So where exactly does palliative care fit into all of this?
Palliative care is woven throughout this entire continuum. It's not a separate or isolated approach. Think of it as a vital part of quality care for anyone facing a life-threatening illness.
That really drives home the point that palliative care isn't just for the very end of life. It can play a role throughout a person's experience with serious illness.
Exactly. And it's important to remember that palliative care isn't just about what we can do medically, it's also about what we should do ethically.
That brings up a really important point. What are the ethical considerations surrounding palliative care? What makes it an ethical imperative?
Well, the World Health Assembly, which guides global health policy, recognizes palliative care as an ethical responsibility of healthcare systems.
Oh, wow.
It emphasizes that healthcare professionals have a duty to alleviate suffering, whether or not a cure is possible.
So it's not just about extending life at all costs. It's about ensuring that people can live with dignity and comfort even when facing a life-limiting illness.
Exactly. And it involves ensuring that palliative care services are available to everyone who needs them, regardless of their socioeconomic status, where they live, or the nature of their illness. It's about providing care that respects your autonomy and your right to make decisions about your own treatment in partnership with your family and loved ones.
This conversation has completely changed my perspective on palliative care. It's clearly so much more than just managing symptoms at the end of life.
It truly is. It's about recognizing the inherent dignity of every individual and providing the care and support they need to live their lives as fully as possible for as long as possible.
I'm already thinking about palliative care in a whole new light.
Yeah.
But before we move on, I'd love to revisit those real-life cases we talked about earlier, those of JN and MN. We focused on the medical and social complexities. But I'm curious to hear more about the emotional and spiritual aspects of their experiences.
Okay.
What kind of challenges were they facing, and how did palliative care help them address those challenges?
That's a great question. Both JN and MN were facing their own mortality, dealing with fear, uncertainty, and maybe even anger or regret. They might have had spiritual questions they needed to explore or simply yearned for a sense of peace.
Yeah.
And their families were undoubtedly on their own emotional roller coaster. The pain of watching a loved one suffer, the anticipation of loss, the struggle to cope with the demands of caregiving. It's a lot to process.
It certainly sounds like it. How did the palliative care team help them navigate those difficult emotions and spiritual questions?
That's where the expertise and compassion of the palliative care team truly shine. They provided counseling and support, creating a safe space for both patients and families to process their emotions and explore their spiritual needs. They didn't offer easy answers or impose any beliefs, but rather walked alongside them on their journey, offering comfort, guidance, and a listening ear.
It sounds like palliative care recognizes that healing isn't just about the physical body. It's about addressing the emotional and spiritual wounds as well.
Absolutely. It's about caring for the whole person. And that's what makes palliative care so powerful. It honors the dignity of every person regardless of their illness and strives to provide them with the care and support they need to live their lives as fully as possible for as long as possible.
This has been an incredibly insightful discussion. I
Right.
feel like I'm just beginning to scratch the surface of this topic.
You're right. There is so much more to learn about palliative care.
But for now, we'll have to pause here. We'll be back with part 2, where we'll dive deeper into the public health perspective on palliative care, exploring its potential to transform healthcare systems around the world. Until then, thanks for joining us on The Deep Dive. Welcome back to The Deep Dive.
Thanks for having me.
In part 1, we started to kind of peel back the layers of what palliative care really is, moving beyond the common misconception that it's only for the very end of life.
Yeah.
We talked about how palliative care can be there for you right from the point of diagnosis, working alongside curative treatments to improve your quality of life.
Right.
And we explored some real-life stories that showed just how complex and multifaceted this type of care can be.
Yeah, it's really about the whole person.
Now, in part 2, I'd like to zoom out a bit and look at palliative care through a wider lens, that of public health.
Okay.
We touched on this idea briefly last time, but what does it actually mean to think of palliative care as a public health strategy?
It means recognizing that palliative care isn't just a specialized service for a select few, but a fundamental aspect of healthcare that everyone should have access to.
Yeah.
It's about shifting our thinking and realizing that providing this kind of support is a human right, not just a nice to have.
I love that framing. A human right. It really changes the conversation. But how do we actually put that into practice? How does this public health approach translate into real-world change?
The World Health Organization has been a champion for this approach, urging countries around the world to integrate palliative care into their healthcare systems.
Okay, that sounds like a huge undertaking.
It is, but it's absolutely essential if we want to ensure that everyone who needs palliative care can actually get it.
So what are some of the building blocks of this public health strategy? What needs to happen to make this vision a reality?
Well, one major issue we need to address is access to essential medications for pain relief, particularly opioids.
Okay.
This is a huge problem globally.
Yeah.
Many countries have really strict regulations around these medications, which makes sense on one level, but it can also prevent people from getting the relief they desperately need.
Yeah, we talked in part 1 about how that lack of access leads to needless suffering. It seems like a real ethical dilemma.
It is. We have to balance the need to prevent misuse and addiction with ensuring that people who are suffering can access the medication they need.
Yeah.
This public health approach means advocating for policies that strike that balance, making sure essential palliative care medications are available while also promoting responsible use.
It's about making sure the system works for everyone, not just a select few.
Exactly. And beyond medication, education plays a crucial role too. We need to make sure healthcare providers have the knowledge and training they need to provide high-quality palliative care.
I imagine that also involves breaking down some of those persistent misconceptions about palliative care, like the idea that it's only for the very end of life.
Absolutely. Many healthcare providers still hold that outdated view, so education is key to changing those perspectives.
Yeah.
We need to integrate palliative care principles into training programs so that healthcare professionals are equipped to provide this type of care from the moment a patient is diagnosed.
That makes perfect sense. And I imagine there's also a need to educate the public about what palliative care is and the benefits it can offer.
You're absolutely right. Public awareness is just as important as educating healthcare professionals.
Okay.
There's still a lot of confusion and misinformation out there, and that can be a major barrier to people seeking care.
I can see how that would be a problem. If people don't even know what palliative care is, they're not going to ask for it. Or they might have preconceived notions that prevent them from accessing the support they need.
Exactly. So raising public awareness is crucial. We need to educate people about what palliative care really is, how it can benefit them, and how they can access those services in their community.
It sounds like this public health approach has a lot of moving parts. Changing policies, improving access to medication, educating both healthcare professionals and the public.
It does, but each of these components is essential if we want to create a world where everyone has access to quality palliative care.
I remember our sources mentioned a World Health Assembly resolution that specifically addressed palliative care. Can you tell me more about that? What were some of the key recommendations?
That resolution, passed back in 2014, was a huge step forward for palliative care advocacy. It was a clear acknowledgement by the global health community that palliative care isn't just a medical issue, it's a public health and human rights imperative.
That's a powerful statement.
It was. The resolution urged member states to take concrete steps, including developing palliative care policies, securing funding and resources, supporting families and caregivers, and integrating palliative care training for healthcare professionals.
Those sound like some pretty significant recommendations, almost like a call for a systemic overhaul of how we think about and approach palliative care.
Exactly. It's not about making minor tweaks here and there. It's about a fundamental shift in our healthcare systems to make palliative care available to everyone who needs it.
And it sounds like they were emphasizing the need to provide palliative care throughout the entire course of a serious illness, not just at the end of life.
Absolutely. They specifically called for palliative care to be integrated into primary care settings, community health centers, and home-based care programs.
Yeah.
They recognize that palliative care needs to be woven into the fabric of our healthcare systems, not confined to specialized units or hospitals.
That aligns with what we've been talking about, the idea that palliative care is part of a holistic approach, addressing the needs of the whole person throughout their experience with a serious illness.
Precisely. It challenges that narrow view of palliative care as only being relevant in the final stages of life.
And the resolution also addressed the issue of access to essential medications, right?
Yes, it did. It specifically called on member states to ensure adequate supplies of essential palliative care medicines, including opioids.
Okay.
And it urged them to review and revise their national regulations and policies to improve access to pain management while still upholding the principles of responsible use.
So again, it's about striking that balance, ensuring access for those who need it while also preventing misuse.
Exactly. And it recognizes that pain relief is a fundamental human right, something that everyone should have access to.
It's all starting to make sense now. This public health approach is about creating a system of care that supports both individuals and families, ensures equitable access to resources, and upholds the dignity of every person.
That's a great way to put it.
But I'm curious to see how all this translates into action. Are there any real-world examples of how palliative care has been successfully integrated into healthcare systems? What does this actually look like in practice?
There are actually some really inspiring examples from around the world.
Oh, cool.
One notable case is the Catalonia WHO demonstration project in Spain.
Okay.
It launched back in 1990 with the aim of integrating palliative care into the regional healthcare system.
What were some of their key strategies? What did they do to make this happen?
They focused on three main areas.
Oh.
First, they developed dedicated palliative care units within hospitals and made sure healthcare professionals were trained in palliative care practices. Second, they established home care teams to bring palliative care services directly to patients in their homes.
Okay.
And third, they created a network of outpatient clinics where people could access specialized palliative care consultations.
So they were creating a comprehensive system that could provide care in a variety of settings.
Exactly. They recognized that palliative care can't be confined to a single location or type of service. It needs to be embedded throughout the healthcare system to be truly effective.
And did they see positive results from these efforts?
Absolutely. After 10 years, they had significantly increased access to palliative care across the entire region.
Wow.
More patients were able to receive care in the comfort of their own homes, which allowed them to maintain their independence and stay connected to their families.
Okay.
And they also saw a decrease in hospital admissions for symptom management, which shows that their integrated approach was working.
That's amazing. They were able to improve both the quality of care and the efficiency of the healthcare system.
Exactly. It's a powerful example of how approaching palliative care from a public health perspective can lead to win-win situations.
It proves that it's not just about doing the right thing ethically, it's also about creating a healthcare system that's more effective and sustainable in the long run.
That's exactly right. And the Catalonia project provides a model that other countries can learn from and adapt to their own contexts.
Our sources also highlighted another interesting example, the Neighborhood Network in Palliative Care Initiative in Kerala, India. This program seems to take a very different approach.
It does. It's a great example of community-based palliative care, showing how everyday people can be empowered to provide care and support to their neighbors.
It sounds almost like a grassroots movement for palliative care.
That's a great way to put it. It's a truly inspiring example of what's possible when communities come together to care for one another.
So how does this initiative actually work? What makes it so unique?
The Neighborhood Network in Kerala starts with a simple but powerful idea. Palliative care should be available to everyone, regardless of their background or medical condition.
Okay.
They realized that the existing healthcare system simply couldn't reach everyone in need, especially in rural areas.
Yeah.
So they decided to flip the script and empower communities to take care of their own.
What an interesting concept. How do they actually go about doing that?
They started by forming local neighborhood networks, each made up of volunteers from within the community.
Okay.
These volunteers, many of whom had no prior medical experience, received basic training in palliative care principles and practices.
So it's about equipping ordinary people to provide basic care and support to their neighbors who are going through difficult times.
Exactly. It's about recognizing that palliative care isn't just about specialized medical knowledge, it's also about human compassion and the willingness to step up and care for those in need.
What a beautiful idea. And it sounds like it's been incredibly successful.
It has. These neighborhood networks provide a wide range of services, including emotional support, practical help with everyday tasks, basic symptom management with medication prescribed by doctors, and even advocacy to help people navigate the healthcare system.
It's amazing to think that a network of volunteers can have such a profound impact on people's lives.
It is, and it really speaks to the power of community and the importance of human connection.
So this initiative is really putting that idea of palliative care as a human right into action.
It is. The Neighborhood Network has dramatically increased access to palliative care in Kerala.
Yeah.
It's estimated that over 80% of people who need palliative care in the region now have access to it, thanks in large part to these community networks.
That's remarkable, especially considering the challenges of providing healthcare in a country like India. What a testament to the power of community-driven solutions.
It really is. It shows that you don't need fancy hospitals or expensive equipment to provide compassionate, high-quality care. Sometimes the most powerful medicine is simply human connection and the willingness to show up for each other.
Both the Catalonia Project and the Kerala Initiative seem to have one key thing in common. They involve the community in a really meaningful way.
Absolutely. Engaging with communities is essential for the success of any public health approach to palliative care.
Why is that so important? What does community engagement actually bring to the table?
Well, for starters, it ensures that palliative care services are tailored to the specific needs and cultural context of each community.
Right.
What works in one place might not work in another, so it's crucial to involve local people in the planning and decision-making process.
So it's about moving away from a one-size-fits-all approach and recognizing that every community has its own unique needs and perspectives.
Exactly. And when people feel like they've had a voice in shaping the services they receive, they're more likely to trust those services and utilize them.
It's about creating a sense of ownership and responsibility within the community.
Exactly. It's about empowering communities to be active participants in their own healthcare rather than passive recipients.
That brings us to another crucial aspect of the public health approach to palliative care: ensuring access to essential medications,
Right.
especially opioids.
Right.
We've talked about the importance of that access, but what are some of the obstacles countries face in trying to provide adequate supplies of these medications? What makes this such a complex issue?
There are several major challenges. One is the misconception that opioids are inherently dangerous and addictive.
Okay.
This fear can lead to overly restrictive regulations that make it extremely difficult for people who legitimately need these medications to access them.
It seems like there's a real tension there, the fear of fueling the opioid crisis, while also recognizing the need for effective pain relief.
It is a delicate balance. We need to prevent misuse and diversion, but we also can't let that fear prevent people from getting the pain relief they need.
Are there other barriers besides those misconceptions?
Absolutely. Lack of knowledge among healthcare professionals is another big one. Many doctors and nurses simply aren't trained in how to safely and effectively prescribe and administer opioids.
So even if the medications are available, there might not be enough healthcare providers who feel comfortable using them.
That's right. And then there's the issue of cost. Opioids can be expensive, especially some of the newer formulations, which can make it difficult for countries with limited resources to provide them.
Yeah.
And even when medications are available and affordable, there can be logistical challenges in getting them to the people who need them, especially in rural or remote areas.
So it's a multifaceted problem.
Yeah.
Misconceptions, lack of knowledge, cost, logistical barriers.
It is, but it's a problem we can absolutely address if we're willing to work together.
So given all these challenges, what are some potential solutions? What can be done to improve access to essential palliative care medications?
One key strategy is advocating for more balanced regulations. We need policies that strike a balance between ensuring access for legitimate medical use while also preventing misuse and diversion.
So it's about working with policymakers and regulators to create a system that serves everyone's needs.
Exactly. And education is crucial too. We need to make sure healthcare professionals have the training and knowledge they need to safely and effectively use these medications.
It's about addressing those knowledge gaps we talked about earlier. We need doctors and nurses who are confident and competent in using these medications.
Absolutely. And we also need to explore affordable pricing options. That might involve negotiating with pharmaceutical companies to lower prices, promoting the use of generic medications, or exploring alternative funding mechanisms.
So it's about getting creative and finding solutions that work for everyone.
Exactly. And finally, we need to improve the systems for getting medications to the people who need them, especially in remote or underserved areas.
It's about overcoming those logistical challenges we talked about earlier.
Exactly. There's a lot of work to be done, but we can make progress if we're willing to collaborate and think outside the box.
This has been a really eye-opening discussion. I'm starting to understand that the public health approach to palliative care isn't just about providing individual patient care. It's about creating a system that supports people throughout their experience with serious illness and recognizes their fundamental right to live with dignity and comfort.
That's a great way to sum it up. It's about looking at the bigger picture and creating a healthcare system that prioritizes compassion, equity, and the well-being of everyone.
And I'm really struck by the importance of community engagement in all of this. It seems like communities play a crucial role in making palliative care accessible and effective.
They absolutely do. Communities are the foundation of any successful public health approach.
Yeah.
When communities are empowered to care for their own, when they have access to the resources they need, and when they feel a sense of ownership over how palliative care services are delivered, that's when we see real, lasting change.
So it's not just about top-down solutions. It's about grassroots efforts and community-driven initiatives.
Exactly. It's about recognizing the power of communities to care for one another and create systems that meet their specific needs.
This has given me so much to think about. But before we wrap up part 2, I want to touch on one more aspect of the public health approach to palliative care: data collection and monitoring.
Okay.
Why is it so important to collect data on palliative care services and outcomes? What purpose does that data serve?
Data collection is absolutely crucial for several reasons. First, it helps us understand the scope of the need for palliative care in a particular community or country.
Okay.
By gathering information on the number of people living with life-limiting illnesses, their symptom burden, and their current access to care, we can get a clear picture of where the gaps are and what resources are most needed.
So it's about identifying the areas where we need to focus our efforts and tailor our interventions.
Exactly. Data allows us to be more strategic and efficient in how we allocate resources. It also helps us to evaluate the effectiveness of our palliative care programs.
Oh.
By tracking outcomes like symptom control, quality of life, and satisfaction among patients and families, we can see if our programs are actually achieving their goals and identify areas where we need to make improvements.
So it's about accountability and continuous improvement.
Yes. Data allows us to track our progress, make informed decisions, and ensure that we're providing the best possible care.
I can see how that data can be a powerful tool for advocating for palliative care, especially when trying to demonstrate its value to policymakers and funders.
It absolutely can. Data helps us make a compelling case for investing in palliative care.
Yeah.
It allows us to show that it's not just the right thing to do ethically, but also a smart investment from a public health and economic perspective.
This leads us to some really important questions that we'll delve into in part 3 of our deep dive. What are the ethical considerations that arise in the context of palliative care, and how can we advocate for better access to these services, both locally and globally?
Those are great questions, and I'm looking forward to exploring them with you in part 3.
For now, we'll leave you to ponder those questions.
Okay.
We'll be back soon to wrap up our exploration of palliative care and its potential to transform how we care for one another.
Sounds good.
Until then, thanks for joining us on the Deep Dive. Welcome back to the Deep Dive.
It's great to be back.
In parts 1 and 2, we explored kind of the many facets of palliative care, going beyond the common misconception that it's only for end-of-life care.
Right.
We talked about its holistic approach, its benefits for both patients and their families, and its growing significance as a public health strategy.
Yeah, it's a really exciting time for the field.
Yeah, and we even looked at some incredible examples of how palliative care is transforming healthcare systems around the world.
Absolutely.
But now in this final part, I'd like to shift gears a bit and kind of delve into the ethical dimensions of palliative care. You know, we've talked a lot about how everyone deserves access to quality palliative care, but what are some of the specific ethical challenges that kind of come up in this field?
Well, that's a really important question. Palliative care, by its very nature, deals with some of life's biggest questions, and there are often really complex ethical considerations for healthcare professionals, patients, and families to navigate.
Yeah, I can only imagine. Can you give us some examples of the kinds of ethical dilemmas that might arise?
One of the most common challenges is figuring out who gets to make decisions about a patient's care, especially when their illness progresses, and they might not be able to make those decisions for themselves anymore.
That's a tough one. Who gets to decide what happens when a patient can no longer speak for themselves?
Right. It brings up all sorts of questions about respecting a patient's wishes, involving their family in the decision-making process, and making sure everyone's voice is heard. It's a delicate balancing act, and it can be emotionally charged for everyone involved.
Yeah, I've often heard about something called advanced care planning as a way to address this issue.
You're absolutely right. Advanced care planning is all about having those conversations with patients early on in their illness when they're still able to express their wishes clearly.
So it's about empowering them to have a say in their care, even if they later lose the ability to communicate those wishes directly.
Exactly. It's about making sure their values and preferences are known and honored, even when they can no longer speak for themselves.
That makes a lot of sense.
Sure.
Are there other ethical dilemmas that come up frequently in palliative care?
Another challenging area is figuring out how to use life-sustaining treatments appropriately.
Okay.
There can be a lot of gray areas around when to continue those treatments, when to withdraw them, and how to make those decisions in a way that respects the patient's wishes and their best interests.
Yeah, I can see how that would be difficult. Families might have differing opinions on what's best too, adding even more complexity to the situation.
You're absolutely right. Those are the times when open and honest communication is crucial. The healthcare team, the patient, and the family all need to be able to talk openly and compassionately, working together to find a solution that feels right for everyone.
It sounds like there are rarely easy answers when it comes to these ethical dilemmas.
That's true. Palliative care requires a lot of careful thought, taking into account the individual patient's circumstances, their values, and their goals of care. There's no one-size-fits-all approach, and it requires sensitivity and a commitment to open communication.
We've also talked about the ethical imperative to ensure equitable access to palliative care services.
Right.
Why is this such a pressing ethical concern?
Access to palliative care is sadly unequal across the globe. People from marginalized communities, those living in poverty, and those in rural areas often face significant barriers to getting the care they need.
Yeah, that really underscores the importance of viewing palliative care as a public health issue, as we discussed in part 2.
Exactly. If we believe that everyone deserves access to quality care, then we have a moral responsibility to address these disparities and create a more just and equitable healthcare system. It's about recognizing the inherent dignity of every person and making sure everyone has the opportunity to benefit from palliative care, regardless of their circumstances.
That leads us to the question of how we can advocate for better access to palliative care, both in our own communities and around the world. What can we do to make a difference?
There are so many ways to get involved and advocate for change. One of the most important is simply raising awareness about palliative care and its benefits.
Okay.
A lot of people, even healthcare professionals, still don't fully understand what it is or how it can help. So educating the public and advocating for policies that support palliative care are crucial first steps.
It sounds like we all need to become champions for palliative care, spreading the word and working to change perceptions.
Exactly. And supporting organizations that are working to improve access is another powerful way to make a difference. There are so many fantastic nonprofits and advocacy groups out there doing incredible work in this area. Donating your time or money to these organizations can have a real impact.
I can definitely see how those efforts can make a difference. Is there anything else we can do to promote palliative care?
We can also advocate for increased funding for palliative care research. We need more research to understand the best ways to deliver care, measure its impact, and develop new and innovative approaches. Supporting research is an investment in the future of palliative care, and it can lead to real breakthroughs that benefit everyone.
Yeah, it sounds like advocating for palliative care is a multifaceted effort involving education, policy change, community support, and research.
It is.
But it's clearly an effort that's worth it.
You said it. When we advocate for palliative care, we're advocating for a healthcare system that's more compassionate, more just, and more responsive to the needs of all people.
As we wrap up this deep dive into palliative care, I'm left with a sense of hope and inspiration, but also a sense of responsibility.
I agree.
It's been amazing to learn about the incredible work being done around the world to provide compassionate care to people facing serious illness.
Yeah.
But it's also clear that we have a lot more work to do to ensure that everyone has access to the care they deserve.
Absolutely.
This deep dive has really transformed my understanding of palliative care. It's shown me that it's not just about end-of-life care. It's about caring for the whole person, supporting their families, and building a healthcare system that values compassion, dignity, and equity for everyone.
You've captured the essence of it perfectly.
Thank you so much for joining us on this journey of discovery. I hope this deep dive has sparked your curiosity and inspired you to learn more about palliative care and how you can get involved.
Thanks for having me.
And remember, everyone deserves compassionate, high-quality care, no matter what challenges they face in life. Keep diving deep and keep asking those important questions.